families directly impacted, and the first responders and medical personnel on the front lines. There are so many individuals working around the clock to keep us safe and healthy. I'm Patrick Uran, headmaster, asking you to join all of us on the mountain in prayer and gratitude for everyone in our community. For more information about the Academy, visit us at oakmountain.us.
At Tanner, our heroes are fighting the COVID-19 virus around the clock, but you have an important job too, and it's urgent. Stay home.
We all must work together to stop the spread of the COVID-19 virus.
Staying home is the only way to avoid exposing your loved ones to this virus.
Each time you leave your home, you risk exposing yourself and spreading the virus to others in our community and in your home.
Do your part so we can continue to do ours. Stay home.
It can save the life of someone you love.
National headlines and the local stories you care about. WLBB, Carrollton, News Talk 1330, FM 106.3.
Good morning. Welcome to Community Voice. I am your host, Josh Engel. Today is Tuesday, April 21st. It's currently 8:30 in the morning. Joining me today on the phone, we have Dr. Timothy Paul, a board-certified emergency medicine physician. He earned his medical degree from the UCLA School of Medicine in Westwood, California. He completed his internship at Cedars-Sinai Medical Center in Los Angeles, so he probably knows a handful of celebrities, and his residency at Denver General Hospital. There's Dr. Paul right there. I'm guessing I was probably right about that.
About which?
Say that again?
About which? No, I'm sorry.
About knowing a handful of celebrities, considering that you interned at Cedars-Sinai.
Yeah.
And we also have Melissa Robertson. She's a registered nurse and Tanner's Assistant Chief Nursing Officer. Missy coordinates our pandemic response planning efforts and works closely with nursing and our infection prevention team over there at Tanner. Now, this is, of course, the newest installment of our ongoing coverage of the COVID-19 epidemic and partnership with Tanner Health System. We've been keeping track of how things are progressing as well as informing listeners about how everything is on the front line with our medical professionals and our friends over there at Tanner. So good morning to both of you. Thank you so much for joining me on the show this morning.
Hey, thanks for having me.
Yeah, thank you.
Well, I think we'd like to just first start off with could we get possibly the latest numbers, the number of positive tests or folks that are currently at Tanner with a positive diagnosis for the coronavirus, any deaths? So we just wanted to check in.
Let's see. We had 8 new positives last night, which pushes. Do you have that latest count? Okay. I just closed out my computer.
Please.
Go ahead.
Yeah, I looked last night. It was about 353, I think. So that's 363 positive tests. I know we had 19 inpatients in Carrollton. I think we had 1 at Villa Rica.
Excellent.
That's right. We have about 9 or 10 in Carrollton that are under suspicion or being investigated, and I think 6 or 8 at Villa Rica that we're working at as well.
For sure. And thank you again for updating us with those numbers. Do we see these numbers trending down?
I think week over week we've seen a gradual reduction in the average number of tests. Both average number of tests and average number of positives, so there is a downward turn.
Excellent. So are we feeling more optimistic?
Yeah, I think we are. This weekend, I worked nights all weekend, and I really didn't see anyone that I was concerned about having COVID. Prior to that, I would say half the patients I was seeing in the ER had symptoms that were concerning or URI symptoms, certainly cough, congestion, that kind of thing. And we really just haven't seen that this weekend. It's really diminished quite a bit. I think the measures that we've taken in the state, social distancing, people kind of keeping to themselves, has really helped.
Excellent. Good to hear. Well, Dr. Paul, why don't we start off here? So if you could give listeners an idea of what the past few weeks have been like for you as an emergency medicine physician at Tanner. What are you seeing, hearing, overcoming?
What's interesting is we have seen a drop in volume. So we have lost 65% of the patients that we would normally see because people are staying at home. And I think we're all a little concerned about that because the heart attacks, the strokes, the people with appendicitis or things that do need to be seen. I think people are staying at home because they're so worried about getting sick from the virus. And part of the message that I wanted to let everybody know is, our team does such a good job at Tanner. What we do is prevent people from getting infection and preventing the spread of infection. So it is a safe place to come. If you have an emergency, we definitely need to see you. Now, I think your question was more alluding to the fact that how we settled into the new normal. And I can tell you about a month ago, it was anxious times, I think, for everybody. We were all pretty worried about what this was going to look like and what was going to happen. And over the last month, the folks at Tanner have done such a good job of helping to protect the staff, and we've organized the ED into various spots where we put people who are concerned about COVID in a couple of particular areas, and then people that have your normal abdominal pain, chest pain, shortness of breath are in areas where we're not mixing patient populations. So we've really, I think, gotten into a routine now and have a pretty efficient process in place. So we've had a lot of good folks working a lot of long hours, Missy being one of them, and they've done an excellent job.
Well, thank you to everyone, not just you two here on the phone with me, but anyone that might be listening. If you were a health professional and you were on the front line, we know that you're working crazy hours. We know that you are spread very thin considering what's happening. So thank you to everybody for what you're doing. Now, the same question for you, Mrs. Robertson. So what has this week been for you as an assistant chief nursing officer, especially with the pandemic response?
A lot of my role is around performance and infection prevention right now. And so what we are doing is similar. We mirrored the same process that Dr. Paul mentioned and work to create zones where we manage the patients that have symptoms and that we're testing, and as well as those that have. I think we have seen sort of a softening of isolation usage, as well as we a few weeks ago we really were stretching in our critical care areas, which we planned for and had accommodations to expand critical care services. So we were able to accomplish what was necessary, but we have seen that soften a little bit this past week, and we hope to continue to see that trend. We have seen patients have some of them have a very protracted illness with this virus, so sick a long time. For sure,
and yeah, it's definitely positive to see that trend, that curve flattening, that trend dropping some. I'm very glad to hear this report. I mean, it's definitely optimistic. Now, as health professionals, what would you be looking for at the hospital? And feel free to answer, either of you, to answer this question. As a health professional, what will you be looking for to gauge whether Kemp's proposed opening this Friday was a good or bad idea? That's in the news today. They're talking about slowly opening the state back up. What will you be looking for as this happens?
Well, positive testing. Basically we have a month of data now, and it's a really tough decision, isn't it, to decide how to get people back to work so they can make a living. There's a lot of people that are really hurting, and you're trying to balance public safety with people's ability to feed their families and stay solvent financially. And so I don't envy him. It's a hard decision to make, and I'm sure he's making it with a lot of good input from the people he has around him. All of that being said, what we'll be looking for is, we know how many people we've tested. We know what our positive test rate is, and we'll be able to follow that forward as we start to open the state back up. And I'm sure if we were to see an uptick in tests, or if we start to see a heavier burden in our ICUs or people that are getting sick, we'll have to adjust fire, so to speak, and decide to do things a little differently. But I've been amazed at how resilient everybody's been, and they've really done everything that our government officials have asked them to do, and you can see it's borne some results.
Excellent. Well, what about you, Mrs. Robertson?
I would agree. I think that even within our healthcare system, we have seen that our workforce has remained healthy. I think the strategies that we've put forward across the organization, from our urgent cares to doctors' offices to hospitals, EDs, I think we see that social distancing works, that hand washing and appropriate protective equipment like masks and eyewear are effective ways to minimize risk for exposure.
Excellent. Well, so continue to social distance, continue to stay at home until the ban is lifted. And here at the WLBB studios, we're going to keep spraying Clorox on every surface after we touch it. Well, it's about 8:39 right now. We're going to take a quick break, and when we come back, we're going to continue our conversation with Dr. Timothy Paul and a registered nurse, Melissa Robertson. But that's going to happen right after a word from our sponsors.
As we journey through this global pandemic together, Oak Mountain Academy is lifting everyone in prayer and holding the community in our hearts. We continue to pray for all of the families directly impacted and the first responders and medical personnel on the front lines. There are so many individuals working around the clock to keep us safe and healthy. I'm Patrick Uran, headmaster, asking you to join all of us on the mountain in prayer and gratitude for everyone in our community. For more information about the Academy, visit us at oakmountain.us.
At Tanner, our heroes are fighting the COVID-19 virus around the clock, but you have an important job too, and it's urgent. Stay home.
We all must work together to stop the spread of the COVID-19 virus.
Staying home is the only way to avoid exposing your loved ones to this virus.
Each time you leave your home, you risk exposing yourself and spreading the virus to others in our community and in your home.
Do your part so we can continue to do ours. Stay home.
It can save the life of someone you love.
And we're back to Community Voice. It's Tuesday, April 21st. It's around 8:41, maybe. I think it's about that. So I'm your host, Josh Engel. Joining us today on the phones, we have Dr. Timothy Paul, who is a board-certified emergency medicine physician, and Melissa Robertson. She's a registered nurse and Tanner's assistant chief nursing officer. She also coordinates the pandemic response planning efforts and works closely with the nursing and infection prevention team. This is the newest installment in our ongoing series in partnership with Tanner Health Systems, trying to do our best to keep listeners informed on the status or the status of the COVID-19 pandemic that we're all facing. So why don't we just get right back to it? So, Dr. Paul,
yes.
And Ms. Robertson, preliminary results from a recent government lab experiment shows that coronavirus does not survive long in high temperatures and high humidity and is quickly destroyed by sunlight. The study found that the risk of transmission from surfaces outdoors is lower during daylight and under high temperature and humidity conditions. Apparently, it's saying that sunlight destroys the virus quickly. Do you all have any thoughts on this study?
I'm not familiar with that particular study. I think I've seen some information about the coronavirus being not able to survive as well in hot and humid environments. I think you see that with seasonal flu. Hopefully we see that with coronavirus. I think as we go into the summer, people tend to be outside more, which really tends to provide a natural form of social distancing system. Hopefully that helps as well. I still would practice good hand washing. Avoid touching my face after touching surfaces, because if someone's there 5 seconds before you are on a tabletop or a doorknob, you just want to protect yourself.
That's all it takes, even if it's in the direct sunlight. If it happens after a few seconds, you can't be sure. So best to still play it safe. What do you think, Ms. Robertson?
I'm sort of hesitant to I don't think we know enough about the virus yet to be sure. We do know that it is fragile and that we're able to clean it with normal disinfection. Hand hygiene, as Dr. Paul said, is very effective. But I agree with him completely. Social distancing, hand hygiene, being very conscious of not touching your face is what is required.
For sure. Well, actually, Ms. Robertson, what are your thoughts on the antibody tests that are currently making headlines? I know that folks are talking about taking this antibody test so as to know whether or not they had the virus. Do you have any thoughts on that?
We're very excited to see that move forward. Hopeful that once we are able to have access to that testing here in our community, it'd be interesting to see how much exposure and how many people had very mild disease. There are some that are not very unwell, and so it's difficult to spot them in the community. So we are interested to see how much of our community was actually exposed.
For sure. How about you, Dr. Paul?
Yeah, no, we're really excited, actually. And from a healthcare standpoint in the ER, if we can find out the people that have had a mild case and have some form of immunity, it would also make it easier for us to basically cohort our healthcare workers to limit their exposure, and people that have some natural immunity can take care of folks that are sick. Hopefully we continue to see this decline. So I'm encouraged by that. I'm encouraged by some of the studies they've done out in Santa Clara County. In California, they tested, I think, 3,000 people. It saw that a lot of folks actually had exposure and had developed antibodies, which hopefully helps us going forward, provide some what we call herd immunity, that there's people in the community that will be naturally resistant to infection.
Wow, so there were that many cases that just came back on the antibody test.
Yeah, they said about 4 to 5% of the 3,000 people they tested at random actually had antibodies. And that's what's interesting is that it's spreading to folks that really showed no signs. But the good news about that is that mortality rate, with more people have it, is probably really, really starting to decrease. We're only seeing the sickest people that we're testing, so you get a little bit of a bias in terms of how sick people are. That most people that get this illness have mild to moderate symptoms. They're not the really scary stories that you see in the news.
Sure, for sure. This is something that's been on my mind. So have medical facilities and other hospitals across the state, have they been pretty cordial as far as sharing information and reaching out to each other? I know that, I assumed that when something like this happens, it sort of streamlines that communications and everybody, pitches in together. But have you guys had an overall positive experience with other health systems?
I think that there has been a sharing of information and that people are willing to communicate and share what they've learned. But I think in general we have seen those types of relationships even prior to this COVID-19 pandemic. So I would say yes.
Excellent. For sure. And you, Dr. Paul?
That's kind of Missy's arena more than mine. I'm kind of trapped in the ER trying to take care of things there. She's got the bigger view for sure than I do.
For sure. Well, maybe you can answer this question. So, speaking of new information, is there any new information that is coming out in the medical community regarding COVID-19 that listeners might not be aware of? Things that you guys are discovering on the front line that you might be comfortable to talk about?
Yeah, I think there's a lot of new treatments that are coming out. There's a medication called remdesivir that looks like it's going to be a good therapeutic intervention with this illness. There's just small early trials, and they're starting to break out some of the bigger randomized control trials to get us some better data. I think therapeutic medications are continuing to come online, which are going to provide a lot of help for us going forward as well as some of the vaccine trials. Last time I checked, I think there's 70 different trials for vaccines that are going on around the world. So not only are institutions in the state cooperating, but pretty much every country in the world is working together to try to come up with a cohesive approach. So it's interesting how we can all kind of take a step together in the right direction when we're all facing a similar threat. So I'm encouraged. I'm also encouraged by how little infection we have seen, pretty much zero among the healthcare workers at the hospital. The PPE that we've been using, the preventative measures that we've been taking, we've been able to take care of folks safely and efficiently. And again, it's really a credit to Missy's team and Tanner that they've given us those tools to succeed.
That is super encouraging. So, and just a testament to, a lot of the news networks on television, they might not necessarily be spotlighting that unification and that teamwork. But it is something that I think, as you said, we should be encouraged by. Ms. Robertson, the same question.
I would echo what Dr. Paul said. I think there is a lot of innovation and energy behind this pandemic. It has been a crisis, but it is good to see the medical community come together and work as a larger, broader team to identify ways that we can combat and prevent severe illness in our communities moving forward. We have been very fortunate that our leadership team has been very supportive of aggressive protective equipment for our employees. They've worked really hard to be sure that we have what we need, and we saw in some of the studies from Japan that rigorous protective equipment usage and hand washing and proactive social distancing. We use universal mask and eye protection here, so all employees, regardless of whether they're in the clinical setting or not, use a mask and eye protection if they're in the workplace, and we have seen that be very protective. But I'm excited to see America come together in this difficult time to seek solutions and make sure we have the supplies and medications and therapies that we need if we face another pandemic or another wave of this infection. I hope that we'll be better prepared.
Amen. Very good information and very positive words. I am also very excited to see America come back together and watch these wounds heal and hopefully enter into another time of prosperity. But we're going to we need to take another break. So we're going to take a quick break with our sponsor. When we come back, we'll continue chatting with Dr. Paul and Miss Melissa Robertson of Tanner Health System right after this break.
At Tanner, our heroes are fighting the COVID-19 virus around the clock, but you have an important job too, and it's urgent. Stay home.
We all must work together to stop the spread of the COVID-19 virus.
Staying home is the only way to avoid exposing your loved ones to this virus.
Each time you leave your home, you risk exposing yourself and spreading the virus to others in our community and in your home.
Do your part so we can continue to do ours. Stay home.
It can save the life of someone you love.
As we journey through this global pandemic together, Oak Mountain Academy is lifting everyone in prayer and holding the community in our hearts. We continue to pray for all of the families directly impacted and the first responders and medical personnel on the front lines. There are so many individuals working around the clock to keep us safe and healthy. I'm Patrick Uran, headmaster, asking you to join all of us on the mountain in prayer and gratitude for everyone in our community. For more information about the Academy, visit us at oakmountain.us.
And we're back to Community Voice. I am your host, Josh Engel. Today's Tuesday, April 21st. It is 8:51 in the morning. If you're just tuning in, I'm talking with Dr. Timothy Paul, who is a board-certified emergency medicine physician over at Tanner Health Systems, and Melissa Robertson. She's a registered nurse, as well as Tanner's assistant chief nursing officer who coordinates the pandemic response planning efforts. Also, if you're just tuning in and you'd like to listen to this entire episode, go to our Facebook or to the gratacommunications.com website, and you can listen to the podcast on the website. You can watch the video on Facebook. So be sure to check it all out. And come on, let's be real. You want to see the video so you can see me on camera. So Dr. Paul, we only have a few minutes left here, but I wanted to ask you, and this question is for both of you. Are there any specific words of advice for listeners moving forward as we continue into the hopefully final weeks of this pandemic?
Words of advice. I think, I'll just speak personally. I think it's important to try to take care of yourself as well as everyone around you. Take the time to exercise and try to find whatever you need to do to have a good mental health space. It's stressful on a lot of levels. One, you're worried about your health. You're worried about your family, you're worried about your friends and colleagues, and then you're worried about this pandemic that we're dealing with. And I think if we continue to do the things that we've already done and shown that we can do, we're going to be fine going forward. It's just I think what the anxiety created by the unknown and not having faced something like this is difficult for everyone, but I'm amazed at how well everyone has done.
So, and to continue on this question here, would you say that there are, what do you think are some of the things that we have learned as a species, really, from this, the last month? What do you think that we have learned and something that we should carry with us moving forward?
I think in the future, we are going to be able to react to similar health issues more efficiently, having learned from this. We haven't really done anything like this for 100 years. 1918, the Spanish flu would, I think, be the last thing that we had to deal with on a comparable level. But I do think it's important that when people do go through something like this, that they realize that they still have other emergencies. This isn't the only illness, the only process that's out there. If you're having chest pain, we need to take a look at you. If you get hurt, we need to take a look at you. I think I'm a little concerned about people getting sick from other things that we can easily prevent and treat, because they're so worried about the unlikely event that they would get infected going to the hospital. So I do think we've got a lot of good tools and strategies going forward to deal with this kind of process. Making some of the PPE equipment in the United States, as opposed to maybe overseas where some of it's made. Our local vendors around us have really helped us tremendously with the PPE, and we've been fortunate at Tanner where I think some other large metropolitan areas haven't been in order to get the support they need from the surrounding community. So I think we've done better than most people that I have talked to in my field, friends, residents, colleagues. We've been very lucky, so we've been well prepared, and we'll be even better prepared the next time.
Definitely shines a spotlight on the local community, as so many folks have stepped forward to try to produce and provide additional PPE. I mean, we all saw it on Facebook. I mean, there are folks across America with 3D printers printing together those face shields. We got people that are hand sewing face masks. I know several people that are doing that, and that is very inspirational and has definitely played a large part in assisting Tanner in slowing down this virus. So we have about 4 minutes left. Ms. Robertson, the same question to you. Any specific words of advice for listeners moving forward, and what do you think we have learned and will carry with us moving forward?
I'm in total agreement with Dr. Paul. I think we want to be sure that our community continues to pursue the things that maintain their health. We are prepared to take care of you if you do have health concerns. Please don't hesitate to reach out to your provider or come to our emergency department if you're unwell. We have done the things we need to protect both our community and our patients and our employees. We are very appreciative of the support our community and the community businesses have provided. They have really rallied and encouraged and supported our team. So we're thankful for the community we're in, appreciate the fact that we get to provide health care here. Just continue to be healthy.
Well, I'm positive, and I'm very certain that the entire community feels likewise, and is very thankful that you guys have put so much effort into trying to streamline procedures at the hospital, try to separate and make sure that there aren't any unexpected infections, and honestly just putting yourself at risk as well as sacrificing a lot. And I think that this is an important message that Dr. Paul and Ms. Robertson have brought us. If you are sick, if you are feeling, chest pains, if you are struggling, if you think your appendix is about to burst, don't be a hero. Come to Tanner, and they can take care of you. And not only can they take care of you, but they can also sequester you and make sure that you are not at risk of catching COVID-19. So that is a very important message for listeners. Dr. Paul, Ms. Robertson, thank you both very much for joining me this morning on the program. It means a lot to all of us for what with what you're doing there at the hospital.
Well, thank you so much.
Well, thank you for having me.
And thank you for tuning in. Be sure to check out A Community Voice tomorrow, same time, 8:30 a.m. here. And we'll talk to you then. All right, take care.
As we journey through this global the community in our hearts, we continue to pray for all of the families directly impacted and the first responders and medical personnel on the front lines. There are so many individuals working around the clock to keep us safe and healthy. I'm Patrick Uran, headmaster, asking you to join all of us on the mountain in prayer and gratitude for everyone in our community. For more information about the Academy, visit us at oakmountain.us.
At Tanner, our heroes are fighting the COVID-19 virus around the clock, but you have an important job too, and it's urgent. Stay home.
We all must work together to stop the spread of the COVID-19 virus.
Staying home is the only way to avoid exposing your loved ones to this virus.
Each time you leave your home, you risk exposing yourself and spreading the virus to others in our community and in your home.
Do your part so we can continue to do ours. Stay home.
It can save the life of someone you love.